and he came and joined staff last week. So we really love it when we're able to have both staff and families hearing the same information. And I think we were all blown away and left with lots of aha moments. So that made me even more eager to welcome Dr. Dalton back. Let me go ahead and make sure we're recording.
We are.
Okay, I didn't get a little notification, but are we definitely? Okay, great. Okay, so Dr. Dalton, if you want to go ahead, I'll let you further introduce yourself, and thank you so much for joining us tonight.
Sure. Well, thank you so much for the opportunity. And as a parent myself, I know how busy evenings are. So thank you for all the parents who have taken time out of your busy evening with all the activities I know that you have going on to tune in for this session. My plan today is to talk for about an hour-ish and then open it up for questions. I could talk for many, many hours on this. I think this is a really important topic, and I'll explain why that I think is true. My goal today is going to be really threefold. Number one is it's really important that everyone gets just an education about the state of affairs in children and adolescent mental health, especially when it comes to anxiety and related disorders. We call it the age of anxiety. We were calling that 4 years ago before COVID hit. I think we all know what's happened since then. Number one is to give a lot of education about that. Number two is to talk a lot about the difference between kind of healthy anxiety and unhealthy anxiety, and how do we differentiate between the two. And then most importantly, I want to really give parents a toolbox that they can begin using. And what's really interesting is that the more compassionate the parent is, the more vulnerable they are for kind of getting it wrong and inadvertently doing things that that actually prolong the distress of the children that we all love and care about. So talking a lot about counterintuitive, evidence-based strategies that parents can begin using immediately. Okay, so I'm going to begin where I always begin. I think this is a really important place to start. So many of the kids that I work with, they come in, they feel broken or they feel less than. And I want to always begin, whether it's in a session with a family or in one of these presentations, with an accurate but strength-based view of anxiety. And to that end, I'm only half joking when I say that if you have a kid who's smart, creative, and compassionate, the universe will go ahead and throw anxiety in for free. It really is a package deal. If you think about it, creativity and anxiety ask exactly the same question, just in very different ways. They both ask, what if? The neuroscience tells us that many of the same brain circuitry responsible for anxiety light up for empathy as well. And so rather than being a flaw or a weakness, the vulnerability for anxiety is in reality simply a shadow cast by these virtues. And the great news is that anxiety is very, very treatable. And the majority of kids show very significant and often complete reduction in the ways that anxiety is interfering with their life. But these virtues remain fully intact. And so our goal is to help the kids learn things they probably would not have learned any other way. For example, they can learn how to overrule fear as a decision-making tool. They can learn how to pursue their values rather than pursuing their comfort. And these are not just skills for kids to use. These are lifelong skills that are tremendously important. So I really do believe strongly that a kid who's dealt with anxiety that's gotten in the way of their living and who's learned a lot of the counterintuitive strength techniques and strategies to use with it are better off for having gone through it than if they've never had that experience at all. So if you are a parent of a child who's experiencing lots of anxiety, as I'm sure many of you are, you wouldn't be in this talk tonight, just know that in many ways your kids are extra alive. And we do not want to think of this as an indication of a flaw or a weakness, but it does tell us that these kids and parents as well, they need an owner's manual for their nervous system. They need to better understand what they're experiencing to be a really informed observer of the process they're going through. Okay. Okay, so I learn a tremendous amount from the kids and families I work with, at least as much as they ever learned from me. And this was something that one of my former patients wrote in an essay. And I think this really captures the experience about what it's like to be living with an anxiety disorder. And they said that having an anxiety disorder is like being stuck in that moment when you realize that you've leaned too far back in your chair, but have not yet fallen. And I think that really captures the internal experience for these kids. I had a 12-year-old, maybe 15 years ago now or so, and he came in with a diagnosis of depression. It's kind of a cousin of anxiety in a lot of ways. And I asked him what it was like for him to have depression, because we know that kids experience it in different ways. And I'll never forget what he said. He thought about it for maybe 3 seconds and gave me the best definition of depression I've ever heard for kids. He said that depression made his life feel like a stick of chewing gum that lost its flavor. And I think that really captures the experience as well, because we know the opposite of depression is not happiness, it's vitality. It's being really alive and leaning forward into life. So I always want to share what I learned from the kids and families that I work with. I think that really captures the experience they're going through in really excellent ways. Okay, so now we're going to get into the heart of what makes an anxiety become disordered. How do we know? How can we tell the difference between the two? And so to explain this, I'm going to begin with a metaphor that will pay off in the next slide. So I want you to imagine that this morning you're running a little bit late for work, and you go downstairs, you put your bagel or your toast in the toaster, and you go upstairs to finish getting dressed. You can never tell by the sound of the alarms if you burnt your toast or the curtains are on fire. It's going to sound the same, whether it's a false alarm or a real alarm of danger. And that's going to play into the discussion about anxiety versus anxiety disorders. So let's talk about healthy anxiety. So I think that anxiety and pain are actually very, very similar processes. Pain says, don't keep doing this thing, you're damaging your body. Where anxiety says, don't do that thing because you may damage your body. So it keeps us safe. It stops us from making really bad mistakes of things that are not particularly good for us to do. If the alarm is working the way it's supposed to, it's an alarm that goes off when it's supposed to, and it doesn't when it's not supposed to. The third thing that anxiety does, it's really important for us, is that evolution wants us, if we're doing something and we get sick or scared when we're doing something, we will learn to never do that thing ever again. Okay, it helps us to prevent the repetition of mistakes. And if it makes us sick enough, hurt enough, or scared enough, we only need one time to learn our lesson. If you ever had food poisoning after eating something you used to enjoy eating, you will understand the power of that conditioning experience. So anxiety is really important for the protection of our species. It stops us from doing dumb things. It goes off when it's supposed to. It doesn't when it's not supposed to. And it helps us to learn from our experiences. If we do something and we get really scared while we're doing it, it will be red flagged in our memory, and we will never, ever forget that thing and make that same mistake a second time. What makes an anxiety become disordered, and unfortunately, even people in the field get this wrong, it's really not the intensity of the anxiety. If you're in a really dangerous situation, I actually want you to be really anxious because you won't get distracted. A few years ago, I had the real experience of being chased by a bear in the woods. My dog thought it was fun to chase some other bear. Long story, but everyone was okay. But I was very anxious while I was being chased from a bear. And that was a good thing, because I wasn't going to go and look at the flowers that were blooming nearby, or think about how cute that cub looks and how comfy it would feel to go over and pet it. What makes an anxiety become disordered is not the intensity of the anxiety, but only the goodness of fit to the situation. So think of it as fundamentally a false alarm, where the fear is 100% real, but it's the danger that's not. Now we're going to go back to the smoke alarm example in the previous slide. So we can't tell if we burned our toast or the curtains are on fire, and we certainly can't tell, based on how anxious we are, how accurate our view of the danger is. And so what do? well, we fall back into what I call our default factory settings as humans, which is to avoid and escape in the presence of anxiety. Well, avoiding things that are dangerous, like bears that growl, highly recommend, 10 out of 10. But when we avoid things that are scary but not dangerous, we are in effect firing the very best teacher we will ever have in our lifetime, which is our own experience that would have taught us that while the fear was real, the danger never was. And so when we avoid things that are scary but not dangerous, we create this target for all of the treatment basically that we do. And it's in those two words in the bottom right, unnecessary avoidance. And so I have this joke that, yes, I direct an anxiety treatment center, but I don't treat anxiety itself. I don't have to. Anxiety itself is temporary and harmless. What I treat is avoidance, and avoidance can ruin lives. Now, what's really interesting is if you might have a kid who avoids raising their hand in class, or even going to school, or going to a party, or any kind of a novel situation, but that's actually the illusion. That's only the part that we can see. What they're avoiding is actually the emotions they expect to feel doing that thing, or the emotions they feel when they're thinking about doing that thing. And we call that experiential avoidance, the trying not to feel a certain way. And the more and more research that comes out tells us that paradoxically, the more that we try and help our kids to avoid the experience of anxiety, the more vulnerable they will become to the experience of anxiety. And so this is going to get into the counterintuitive nature of everything that we do, is that we help our kids to really persist in the presence of distress. We talk to these kids about responding to their own anxious thoughts and feelings in the same way a palm tree responds to the wind. It doesn't fight against it because there's no need to, because it knows it can just outlast the wind. And that's really the fundamental aspect of what we're going to be talking about today. And if there's one take-home message from the entire presentation that I want you guys to keep in mind, it's going to be that anxiety and avoidance are teammates. Okay. Now, avoidance is the lifeblood of the disorder. It's the oxygen. It's whatever metaphor that you want to use. So the really good news is that if we can arm kids with what we call non-avoidant coping skills, if we can help parents to not fall into that trap of trying to help our kids not experience anxiety, then the anxiety itself will die a natural death. It's like taking the oxygen away from the fire. We never touch the flames, and yet still we extinguish them. Okay, so in these words is the entirety of this presentation in a nutshell, is avoidance and fear are teammates, and that our job as parents is to not protect our kids from the experience of anxiety, but to teach them that they can persist and outlast the experience of anxiety itself. Okay. In other words, that one of the things that we want all of these kids to know, like like a little story that we've all been to. You go to the ocean, you're a little kid, maybe you're 7 years of age, and you go out with an older sibling or a parent into the deeper water. And then this big wave starts to form, and it starts to come in towards us. And our instincts, all of ours, are to run back to shore, to try and get back to the dry ground. But you know what? The water is going to move faster than we are, and the water is going to catch us from behind, and that wave's going to get us into that washing machine spin cycle. The best thing to do is the most counterintuitive of all, and it's to dive directly into the wave. And when we dive into the wave of anxiety, two really important things happen. This is why I love my job so much. I won the lottery when it comes to careers. I get to see kids do things that they didn't think they could do. I get to see it every day, often multiple times a day. But when we do things that we're afraid of, when we dive into the wave, so to speak, we are learning that our estimation of the fear, or sorry, our estimation of the risk was out of proportion to the actual risk. But in my opinion, even more importantly, the kids learn that they can cope effectively with the experience of anxiety itself. Okay. And so this is really the heart of the counterintuitive nature, is that good parents try and help their kids to not suffer. but we also know that growth and comfort are incompatible experiences. And the more that we try and protect our kids, the more we fall into a trap, the more that we think that anxiety is too much for our kids to handle, the more we teach them they can't handle the experience of anxiety. Okay. Thank you. Try it again. Okay. Oh, sorry. No, I think I got glitched out there for a second. Let me just go back to the slides here. Okay. Sorry about the technical glitch. We will come back to the, okay. So what is really important is, it keeps moving by itself. I apologize for that. For this slide here is that almost everyone, when they come into my office the first day, they have some version of the same request. Hey, doctor, how do we get rid of the anxiety so that my child can do this thing that they're afraid to do? And I always joke, that's like saying, I'd love to go to the gym, but I want to get in shape first. Doing the thing that you're afraid of is not the outcome of treatment, it is treatment. Persisting in the presence of distress is the active ingredient, it is the mechanism of change for these kids. And so I want this kind of paradigm to shift here for parents of anxious kids is that if you are doing something that is important to you or is important to the child, and they are experiencing anxiety while they're doing that thing, it's like getting sweaty at the gym. It doesn't mean that anything is going wrong or that you should change a thing about what you're doing. It only means you're getting a good workout. So we measure progress not in the experience of anxiety, but in the use of avoidance as a way for kids to regulate their emotions. Okay, really important. And again, very, very counterintuitive ideas. Let me talk briefly about why this is so important. So there's three things about anxiety disorders that I want you to know. One is that they're by far the most common category of mental health disorders across the lifespan. Number two, they affect us at the earliest age of any acquired kind of, mental disorder. So half of all individuals who during their lifetime will have an anxiety disorder have one before they turn 11 years of age. And third and most importantly, they're the most treatable category of mental health disorder. So these numbers I'm sharing, these are pre-pandemic numbers. Some of these numbers go back as far as 19 years ago with a really good study that was looking at the prevalence of anxiety among our kids and teens. So even before the pandemic, we know that on any day between the ages of 13 and 18, about 8% of our kids will have an anxiety disorder. But before they leave high school, so between the ages of 13 and 18, we're looking at almost a third of all of our kids that we love are going to have at least one anxiety disorder. And about 8% will have a severe disorder that really gets in the way of their life. These are the kids I love working with who are complex and maybe having a difficulty doing everyday activities like going to school or in some cases even leaving the house. And one of the reasons why I give so many of these talks is that only a minority, and some estimates are as low as 18% of these kids receive any treatment. And by the way, you compare that to ADHD, about 79% of those kids receive treatment. Well, think about it. The kids with those kinds of challenges often draw attention to them, where the anxious kids are trying not to in a school environment or elsewise. They're trying to blend into the background. And so we have these very effective treatments. They're not effective enough. We need to keep doing research about them. But in terms of medical interventions, they're very effective. But they're tragically underutilized. And then since the pandemic, I'm sure that many of you parents have discovered this, that the need far exceeds the availability of appropriate treatment for these kids. Waiting lists are prohibitive. One of the things that we're doing, and I think other places are too, so I really, if you're looking for services for a kid, I would please be open to an evidence-based group delivered treatment for kids. They're as effective in the majority of cases as individual, only parents don't know to ask for them. And we can get more kids in services if we do it in a group format. And plus kids are used to being in groups, they're on teams, they're in school every day. It's a natural modality for them. So if you're not familiar with those, please look into them. An evidence-based group that is specific and well researched is very, very effective and more available than an individual is, given the waiting list that we're dealing with right now. The girls have it worse, like a lot of things in this world. And so we're looking at, and again, before COVID hit, about 38% of girls before they leave high school will have at least one anxiety disorder. And that is 10 times the rate of eating disorders. And the girls have it worse for mood stuff too. I know this isn't the purpose of this talk, but the new data will take your breath away that came out since the pandemic in 2021. And in that year alone, 57% of our high school girls reported feeling persistent sadness and hopelessness. So we're at numbers that we've just never, ever seen before. There was new data that came out in the last couple of weeks that absenteeism, chronic absenteeism among our students across the country has gone up 93% since the pandemic. There is so much need out there. As a comparison point for just how aberrant these numbers are, in 2019, before we even had a word for COVID, the average teen was 5 to 8 times more likely to show symptoms of an anxiety disorder compared to the same age kids during World War II, the Great Depression, and the Cold War. Okay, that is the age of anxiety. This is the water these kids were swimming in before this hurricane of COVID came to hit. Okay, really important for us to know about that. The question always comes up as to why, and there's a lot of answers to it. It's not simply one thing, but I think this is a helpful view. If you look at the one in the black and white here, if you can see it on your screen, this is the gold medal winning vault, and she does an amazing job. I could never hope to do what she does, but look at what the person has to be able to do to have the same result a little over 50 years later. And then, of course, this is a metaphor. Think about applying for colleges or getting onto a selective athletic team, or whatever thing that you're looking at in a child's life. Just know that it's harder to do it than it used to be because the expectations and the demands are simply higher than they used to be. Now, we're talking about these kids, but they're, of course, also students. And so what we see happen all the time is that when kids are in a persistent state of anxious arousal, and this goes beyond what I can talk about in our talk here, but it certainly interferes with their ability to retain and process new information. This is a screen capture from a YouTube video, and she's up there on purpose. And I want you to imagine someone's trying to teach her calculus. Well, forget that. Imagine someone's giving her a grocery list of 4 items. What are the chances she's going to remember that? I had an experience with my family. We had this dream vacation planned for Hawaii, and we arrived in Maui the day of the fire, and we drove to evacuate in the middle of the night, and on rickety mountain cliff roads and hurricane force winds, and drive through the night to the airport. And I thought I was doing just, and then I was talking to the car rental place to cancel my car reservation, and they asked me for my cell phone number, and I could not remember my own cell phone number. It is really hard to learn and demonstrate knowledge when you're in an anxious place. And so it's rules to understand that the anxiety will
I think we might have lost Dr. Dalton. I think we might have lost you for a moment.
Oh, did you lose me? Okay, I was afraid that might happen.
I don't know if turning the camera off might help a little bit. I'm not sure, but it's a tiny bit glitchy.
Okay, let me turn off my video and see if that helps. Okay, I apologize for any technical challenges. The beauty of Zoom is that we can work with 700 parents, but then there's these tech issues that come up sometimes. Okay, so what I was saying before is that, if you didn't hear me, is that being anxious interferes with our ability to learn and to demonstrate knowledge. And so it's just really important for parents to have that understanding that, of course, things are harder to do when you're in a high anxiety state for these kids. One of the things that we want to do is that we want to give kids skills. And let me explain what I mean by that. This is an analogy that I think is an important one. It's a kind of a story or a metaphor. And I think this is helpful for anyone who is either themselves dealing with anxiety or has a child who's dealing with anxiety. Is I want you to imagine that you are visiting New York City and you're on the observation deck of the Empire State Building. And you're enjoying the view. It's a beautiful day. You're talking to some friends, and then out of nowhere, the fire alarm goes off. Well, if you're built like most of us, you're going to be a 7, 8, 9, or 10 out of 10 level of anxiety. You're going to have a lot of kind of body anxiety symptoms, and you'll be not thinking about your dinner plans or what you're doing the next day. You will be thinking about, how do I get out of here? We call that an urge to flee. You might have a lot of intrusive thoughts, scary things about, what if there's a fire? What if it comes up to where we are? Or horrible traumatic recollections of 9/11 and so forth. Now, I want you to imagine the same scenario, but this time there's an announcement and they say, this is the superintendent of the building. We're here with the fire marshal. There's been some problems with our fire alarm system. We'll be testing it the next half an hour. If it happens to go off, please disregard it, and we'll announce anything over the loudspeakers that's important for you to know. So you hear it, and you kind of go about your business. 18, 19 minutes goes by, you're talking to your friends, and then out of nowhere, the fire alarm goes off. Well, you will still jump out of your skin because you weren't expecting it to go off in that moment. If you're a worker in the building, you probably won't get a lot done while it's going off. And if you're a tourist on the observation deck, you'll be really irritated and annoyed it's going off when you're there. But you will likely not have that kicked in the gut, high level of anxiety paired with an urge to flee. And the difference, and this is the critical part, the difference lies not in the alarm, but only in what you think the alarm means, or more importantly, what you think it does not mean. Because your appraisal, your interpretation of the importance of the alarm will fundamentally and profoundly affect your experience of it. When it comes to these kids and their anxiety, there is no dimmer switch, there is no off switch for their anxiety, but we can help them to think differently about what their own anxiety alarm means and what it doesn't mean. Because again, their appraisal of the importance of the alarm will fundamentally and profoundly affect their experience of it. This is not a small deal. Helping them to be an informed observer. We want them to see their own anxiety alarm as an irritating and annoying false alarm that gives them really no useful information. Okay, it's a really important concept for these kids to understand. Another one, I was at a training all day that actually was a member of the audience of, and I was talking to a friend and colleague who was talking about someone that he's working with was a fear of butterflies. And I said, oh, I have a slide about that. And yeah, we do see kids and adults every so often that are afraid of butterflies. Maybe they were stung by a bee or a wasp when they were very little, and now they're afraid of all flying insects or whatever it might be. Well, if maybe this kid's afraid to go out to recess at school because there's butterflies nearby, or to go out in their backyard because there might be butterflies nearby. Well, that kid comes in to see me, and I wouldn't, but I could give them like a Batman utility belt full of fly swatters and bug spray and say, okay, off to recess you go. Well, why wouldn't I do that? Because they'd probably go to recess. Well, I wouldn't for 3 important reasons. Number one, the entire time they're out there, they're going to be on high alert. They're going to be hyper vigilant is the word that we use for butterflies, which means they won't have a lot of fun when they're out on the playground. Number two, if she happens to lose her fly swatter or runs out of bug spray, her anxiety will actually rise above baseline, because every time you're swatting or spraying the butterfly, you're teaching your brain two things: that they are dangerous and you can't handle the emotions that come with it. And third, and most importantly, that girl would never learn that butterflies are harmless. We want the butterfly to land on her nose, like in this picture, and to stay there until it flutters away on its own. So when kids and parents come in with the best of intentions and they're looking for a way to help their kid to avoid the experience of anxiety itself, I will tell them, please stop swatting the butterflies. Anxiety itself is no more dangerous than a butterfly. And yet, for either of them, if you try and swat them away, you're teaching your brain that they're dangerous and you can't handle them. Okay. Very, very counterintuitive, but really, really important for us to understand the similarities between the two. And so we do not want parents or providers, physicians, anyone, to be complicit with helping a kid to not experience anxiety itself. We want them to persist in the presence of the distress. We keep going back to that over and over and over again because it is so critical to understand that. Another thing that we really want kids to do is that what's happening is that, let me back up for a minute. There's one common thread that runs through all of the different flavors of anxiety disorders that are in our big book of disorders. It's a complicated term, but a very easy concept. The term is called overvalued ideation. Don't worry about that. What it means is that we as humans think our thoughts are way more important than they are. And so when a kid is having a scary thought, they are confusing that thought with evidence to support it. Okay. They are telling themselves a scary story, but they're forgetting that's all that's happening in that moment, is that they're telling themselves a scary story. And so I will literally show often a trailer for a scary movie for a kid, and I'll have them be an informed observer of their experience. I mean, obviously age appropriate wise, and look at their own internalized experience of, are they having a fear of jumping, or, are they having thoughts about, what might happen afterwards if they remember the scary movie. And then we'll watch the behind the scenes footage on YouTube from the same movie. And obviously they're laughing and it's kind of comical, and it's the least scary thing in the world when you're seeing someone pretend to be afraid and you know that they're pretending. And so what we do is we want the same process to play out for the kids who are having these scary thoughts. We want them to have the behind the scenes footage to their own scary thoughts. And there is a way that we do that, which is very easy, but very powerful in my mind. When a kid is having the what if thoughts, anxiety lives in the future. It's based on uncertainty, and it loves to ask the question, what if? We want to reframe it in terms of what is happening right now. Well, that answer is, well, right now in this moment, I'm having a scary thought about, and then you fill in the blank with whatever it might be. Failing my test, having something bad happen to someone that I love, or whatever it might be. And so when they're able to say, right now in this moment, I'm having a scary thought about that, they are remembering and reminding themselves that they're having scary thoughts. And I'll even, like, if the younger kids, especially, I'll dare them. I'll say, I want you to think about having a sneeze. Most of us sneeze every day at some point. Not that hard to have something that makes us sneeze, but I want you to think about sneezing as hard as you can. Can you make yourself sneeze by thought alone? I've never had a kid be able to do it. Someday, some kid's going to just randomly sneeze at that moment. It's going to be really scary for all of us. Hasn't happened yet. And so what I tell them is, if your thoughts are not powerful enough to make you sneeze, then how powerful are these thoughts? Why are we valuing them in the ways that we are? And so just remembering, being present focused, that I'm having a scary thought about, and then you fill in the blank, can be a profoundly helpful experience. Obviously, for younger kids, they might not be quite there yet to understand what it means to simply have a thought, but we're going to be doing this on an age appropriate level for the different ages that we're working with. Now, one of the things that we see a ton of in our practice, and I used to call it the Montgomery County syndrome until I came down to Northern Virginia, and I think it travels very well. It's called perfectionism. And so it is something that I think is almost a disease among our youth, where they are conflating their value and their worth with their achievement and their standing. And these kids are vibrating like guitar strings with anxiety. And so perfectionism is something that's actually pretty serious. It's a risk factor for some scary, scary things like eating disorders and even suicide attempts. So we don't take it as like, oh, my kid's got to have some problem. I'd like them to try and be too perfect. It's actually a challenge that is very severe for a lot of these kids. Let me explain why. Let's say that there is a clown in the circus, and he is great at juggling, but he has 10 bowling pins in the air, and he's using every bit of his focus and ability he can, but he can keep all 10 of them in the air. And if some stranger goes up to him and says, hey, bozo, and throws him a 10th pin, you never just, or the 11th pin, you never just drop the 11th one. They all come crashing down. Perfectionism can work at low levels of stress, but when it fails catastrophically. So let me share a metaphor that I talk about a lot for the kids and teens I work with who are trying to be perfect. So many years ago, I was flipping the channel on the Discovery Channel came up, and there's one of the survival shows that you see on TV all the time now. And it was this really creatively named one called Survivor Man. That literally was the name of the show. And so his gig was he would go and volunteer to be abandoned in these remote locations with a tripod and a camera and record himself surviving. In this one, he was in Labrador in the winter time. It was the frozen tundra. It was minus something terrible. And it was going to be dark in a few hours. And so he comes to the camera and he says, all right, I got to build a shelter because it's really cold out and it's going to get worse. And so he's building this igloo. And, you know, I think all of us when we were kids saw Chilly Willy or some cartoon that's supposed to look like the one on the left, right? Well, his looked worse than the one on the right. I couldn't even find a picture of that show. And it was built into the side of a snowbank, and it was small and ugly and lopsided. And he came to the camera and he said, you know, I've been trained by the Inuit how to build igloos. Of course he was. He was Survivor Man, right? And he said, but if I were to build that perfect igloo, I could do it before it gets dark. But there's two really important things wrong with that. Number one is I will burn through a ton of my calories and I have no food to eat afterwards. And number two, and more importantly, in order to get that perfect igloo done before it gets dark out, I will have to work so hard that I will build up a sweat. If I get sweaty, my clothes will get wet and I will climb into that perfect igloo and I will freeze to death tonight. What I'm building is something better than perfect. It's what's optimal. And so we teach kids optimalism. We teach adults optimalism, for that matter, that sees failure as feedback, that sees the right answer is always a trick question because there's more than one right answer. We know what is best depends on the given situation that we're in. And so when a kid has many projects or papers or tests being done, and they feel like I need to study for each one perfectly, they're going to, in the end, really decrease their efficiency and effectiveness, increase their suffering tremendously. We need to teach these kids optimalism. We all need to be the counterbalance to the scourge of perfectionism and value derived from achievement culture that these kids feel so immersed in these days. Let me tell you a story. A few years ago, I was seeing a kid actually in this office, and she had missed 2 years of high school because of an anxiety disorder, which is tragically not uncommon for the kids that we work with. It's before COVID. And I noticed something about her that I really liked. She had this strength that I don't think that she knew was there. And so I said to her, hey, I want you to fill in the blank in the sentence. I can be anxious and blank at the same time. And she thought about it for a minute and got this. She was very socially anxious, and she got this stern and serious look on her face. I thought something was wrong. And I said, are you okay? She said, yeah, I'm good. And she leaned in, looked me directly in the eyes, which she normally didn't do. And in a very firm voice, it gave me chills. She said, I can be anxious and strong at the same time. And she was right. And she got back in the very next week to high school and she graduated on time. I asked a younger kid a similar question. He said, I can be scared and brave at the same time. And if there was anything that I could, one sentence I could teach kids, that would be it. You can be scared and brave at the same time. I'm working with two 6-year-old lovely girls with a dog phobia, and they come in together and they named it Scrave, when you're scared and brave at the same time. I love it. I asked an older kid who was 18, been through a lot of treatment, the same question. He said, I can be anxious and any damn thing I want to be at the same time. And that's what we do, is that we teach the kids, we teach the families to be anxious and, or anxious during, rather than anxious instead of. We want to think of it as a passenger that we didn't invite into the backseat of our car, and we can't kick him out, but we never ever give them the driver's wheel and decide where we're going. Okay, so really, the evidence-based treatment is about being anxious and then, dot, dot, dot. And the rest of that are the things that you care about, the things that you value. And we want to, again, teach them to pursue their values, not to pursue their comfort. We also want these kids to be able to be their own coaches. And so I mentioned the first one here, right? So that right now I'm having a scary thought about, or that. Okay, that's a really important one. The idea that fear is temporary and harmless is also really important. And it's important for parents to know this, because so many parents, as I said before, think of these kids as Fabergé eggs that will be broken by the experience of anxiety. No, they will be strengthened by it. Human suffering and struggle is pregnant with meaning and purpose. If we try and prevent our kids from struggling, we are preventing them from growing. And so having them know that they can experience any emotion and be okay is incredibly important. Just because I feel scared doesn't mean anything bad's going to happen, or doesn't mean that I can't do that thing. I am stronger than my fear. If you'll notice, these are examples. Clearly, there's many, many more that we could use here. These are never reasons why they shouldn't be anxious. That would be really invalidating. Like, oh, I'm having the wrong emotion right now, I'm broken. No, these are the things that you would tell yourself about why you can persist in the presence of anxiety. I know I can do hard things because dot, 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 right? And you have them answer that question. Think of the first time that you went off the high dive as a kid and your toes are curled over the side of the diving board and you're terrified. What do you tell yourself? These are the kinds of things that we want these kids to tell themselves when they are facing any of their fears. We have 10 minutes left or so until we open up for a Q&A. This is a really important concept. Again, fancy term, self-efficacy. Those of you that's at Psych 101 will recognize this Bandura's concept from decades ago. Really what it means is how effective you think you can be in meeting the demands of the environment that you're in, basically. The good news is that this is not an attribute like eye color. This is a skill like the violin. And so, like any skill, it can be taught, which means it can be learned, which means it can be practiced, which means it can be improved. And so we know how to do that. One of those things is through mastery experiences. I don't love the word mastery. It doesn't mean that you're a virtuoso at whatever it is that you're doing. It's an area where you are competent, where you know that you can do it. During the pandemic, my daughter is a dancer. Believe me, she does not get it from me, but she's really good at it. And that was something that was incredibly important for her, to have an area in her life where she knew she was highly competent. We also know that we can get this through watching other people do things. And so this can be videos, it can be movies, it can be books about people overcoming things. There was a push among Ivy League professors a number of years ago to have them be open about sharing the struggles they had getting to where they were. The students see the diplomas on the wall behind them. They don't see the struggle and sacrifice that went into it. And so letting people know that struggle is okay, it's essential, is really an important part of this. Verbal persuasion. I can't tell you how important this is. I just came from a 2-day training, what's called Space Treatment by Ellie Leibovitz up at Yale, on lowering family accommodation for anxiety. And he focuses a lot on this in their evidence-based treatment, which is that you validate the emotion. I can tell that you're really anxious. And then saying, I'm 100% sure you can handle it. Having a teacher or a parent or a coach or anyone in their life say, this is going to be really hard and I believe you can do it, is a really powerful, persuasive method to help them to jump forward into the uncertainty. But for kids, this is the way that I describe it. Okay, let's say that there is this bird on a branch, and the bird looks over at the branch it's on, and it notices there's a crack in the branch. Is the bird unafraid because it can think of all the reasons why the branch is strong and unlikely to break? Or is the bird unafraid because it knows it can fly? Knowing you can fly is self-efficacy. Knowing you're going to be okay, not because a bad or hard thing isn't going to happen, but because you can handle bad and hard things. You're going to be okay, not because you won't be anxious, but because you can handle the experience of anxiety. This is the goal. And when people learn, whether they're kids or adults for that matter, and they learn to use other things besides avoidance as a way to regulate their emotions, this is what they learn, that they can handle more than they thought. And this is the best part of my job, is knowing that the skills and knowledge they're obtaining through this process will be applicable to many, many other things in their life down the road. And so if you are a parent who is seeing someone struggle that you love, especially a child, know that you have the front row seat to watching them grow in real time and learn things about themselves and their capacity that they would otherwise not know. Okay. We talk a tremendous amount about flexibility. We talk about, the palm tree responding to the anxiety the way a palm tree responds to the wind. Well, you know what gives the palm tree that ability to withstand the strongest of winds is its flexibility. Knowing that if you're lost in the woods, there's more than one way out. A colleague of mine, Bill Stickster, who I'll be seeing actually in a little bit, has this really important concept of having an illusion of a narrow path to success. The more that you can say and believe that there are many ways that you can accomplish your goals and it's never singular, is a really, really important part for these kids to understand. Okay, skip over that one. Okay, now we're going to go into specific parenting things that, again, are very counterintuitive, but really important to understand. So if you are a parent, whether you're watching this live or on recording, and you have a kid with a lot of anxiety, I want you, just for a few moments in your mind, to separate out the kid from their anxiety. And I want you to think of their anxiety itself, not the kid, but the anxiety itself, as a dog begging for food. Only it's not begging for food, it's begging for two things: attention and what we call escape avoidance. Now, when one of my two dogs is begging for food, it could be really annoying, and maybe they're like drooling on me and like their breath is bad, and it might be tempting to say, okay, fine, here's a big piece of my steak, now go away and never beg again. Yet anyone who has a dog or has ever met a dog or heard of a dog knows the folly in that you'll give this dog a piece of the meat, it'll go away just very, very quickly, and it will come back. And when it comes back, it will beg louder and longer. And yet good parents do this, is that the child's anxiety is begging for avoidance or begging for attention and reassurance from a parent. And yet good parents will feed that dog in the hopes it stops begging for food. Okay. It's a really, really important thing. We care too much about these kids. We care too much about their future to do anything to help their anxiety stick around longer. And when we do things like offer reassurance to a kid, we actually overall increase their suffering and distress, even if in the short term we give them temporary relief from it. Okay, so really understand that anxiety needs attention and it needs avoidance in order to continue. And we're going to basically have a non-cooperation agreement with the child's anxiety. We are not going to do its biddings for it. We call it pillow fluffing because then it will stick around a lot longer. Let's say I want you to imagine that your kid is struggling with a math problem for homework, and you go over and maybe the kid's even in some tears and really upset. Well, you could go over and say, oh, well, the answer is 12. Well, why wouldn't you? Because he'd get the answer, right? Well, obviously he wouldn't, because he wouldn't learn how to solve the problem. He will learn to seek your proximity as a way to cope with frustration and math problems. And so we don't want to give the kids the coping answer either, because if we do that, then we're again teaching the kids to seek our proximity as a way to cope rather than looking internally for skills and abilities. And so what do? Well, we really do this similar approach, whether it's a math problem or a kid who needs help with coping, is that we ask questions, right? We can name and contain the emotion. It seems like you're feeling frustrated or anxious or whatever the emotion is in the given day. Younger the kid, the less words they have, the more powerful it is to name the emotions. And then we say, in our best bank teller tone of voice that we can muster, what can you tell yourself when you feel this way? That serves two functions. Okay, number one is you're giving less attention to it. So that's certainly a positive. And number two, you are helping them look for internally for appropriate coping skills in the presence of anxious arousal or anxiety. And so that's the way our brain learns, is by pairing things together like peanut butter and jelly. And so if you are in a situation where you are repeatedly being cued to look inside for appropriate coping self-statements, then the presence of anxiety itself will eventually become a cue to look internally for these kinds of coping skills. And so we obviously want to give the kids some of these things beforehand, like just because I'm anxious doesn't mean that I can't do it. And then we want to help them practice using those in the presence of the actual emotions. Now, one of the things also is that I want you to imagine for a minute that you're terrified to fly and you win a trip somewhere beautiful, and so you decide to suck it up and to go. And so you're halfway over the ocean, and you hit some turbulence, and the plane's really bouncing around. Well, in addition to white knuckles, you will also be scanning the entire cabin for everyone else's reaction. The more experienced the flyer, the more you will value their reaction. Now, I want you to imagine the flight crew, who is, of course, the most experienced flyers you would think on the plane. I want you to imagine one scenario: flight attendant says, everyone, please remain calm. The wings are very firmly attached. We're going to be just fine with this. There's no reason to stress. There's no reason to worry. Everyone remain in your seats. We'll land in an hour and a half. Now, same situation. This time, the flight attendant says, ma'am, would you like tea or coffee with your lunch? One is offering reassurance, which paradoxically validates the need to ask for it in the future and serves to strengthen the anxiety over time. The other one is modeling non-anxious arousal. Guess which one is better? We want to basically have the mnemonic in our mind that calm is contagious. We want to model containment of the emotion. Their anxiety is not a crisis. It's not a catastrophe. It's uncomfortable. And that's how we want to demonstrate that. We want to have what I call the tea or coffee approach when a child is experiencing significant anxiety. Okay, the last one, and then I'll open it up for questions, is every parent comes in and they say, what do I do when my kid is experiencing anxiety? And I say, I have another great question for you. What do you do when they're not? Certainly, we want to help them to have their emotions validated. We want to persuade them that we believe strongly in their capacity to cope through the anxiety itself. And those are all powerfully important things. There's another thing that's also very powerful and very important, which is how do we catch them coping effectively? And how do we give them a lot of praise for doing it? So here's the story. Let's say that you buy a beautiful new home, but there is this beautiful flower bed out in front that was neglected by the previous owners. It is overrun with these thick, prickly weeds. You try and pull them out, but they're too deeply rooted and you can't. But you don't want to give up on the flower bed, and you can't afford a gardener because you just bought a new house. So what's something you could do? Well, it would take some consistency and it would certainly take some time, but you could plant the flower seeds among the weeds, and you could work to selectively water the seeds and not the weeds. Well, what happens over time is very clear. If you're good at it and you're consistent enough, the weeds will wither and the seeds will grow. And that is one of the most powerful things any parent of an anxious child can do, is to not water the weeds and to water the seeds that you want to see grow. Now, there was a little technical glitch. I was going to show a video at the end, and it wasn't loading very well. But go on to YouTube. If you haven't seen the movie Ray by Ray Charles, about Ray Charles, it's a really powerful scene. I'll just summarize it here. That Ray, and I didn't know this until I saw the movie, was not born blind. He lost his vision at like 7 or 8 years of age. And then this is a flashback scene to that moment when he comes back in. He's just fully lost his vision. He's looking for his pet cricket that had come back in there. And he walks in and he falls over the back of a rocking chair and hits the ground hard. And he's crying and he's calling out for his mom. And it's a really powerful scene. If you've seen the movie, you'll know what I'm talking about here. And he yells out, "Mama, Mama, help, help, I need you." And Mom, against every bit of instinct she has, does not go over to rescue him. Why doesn't she? Well, she knows the world's not going to do this kid any favors, and for a lot of reasons. And so yes, she can go over and hug him and walk him around the room, and that would be really helpful in that moment for him, but it would prevent him from learning that he can compensate for that challenge. And so what does Ray do? Well, he doesn't even know that she's there, and so he does the only thing he can do, which is stand up, brush himself off, and find how to use his hearing as the way to navigate through the room. And when he does that, there's this powerful scene at the end when he goes up to her and he says, I hear you too, Mama, you're right there. And he points at her, and she goes over and gives him the biggest, deepest hug in the world. And that's, in a nutshell, we're trying to not accommodate, we're trying to not teach the kids that they can't handle these things any more than a kid who has poor muscle tone. We're not going to carry them around everywhere in the hopes they will grow stronger. We will help them to do it when it's uncomfortable, to build that very same strength. Okay, so this is me. Be happy to open the floor up to questions and comments. I know there's a lot of people who are live watching this, and I'm sure there'll be even more who are watching it on video recording, but it is being videotaped, so I want to make sure everyone knows that.
Okay, well, before we take questions, Dr. Dalton, I just wanted to thank you so much. And I think along with my colleagues Gina and Emma from the Parent Resource Center, I believe Dr. Kristen Devaney is also on the call, and she is our she leads our school counseling work. She's our supervisor of school counseling. I think the best way to do this, we have a couple of questions in the Q&A. So if you have a question that you'd like to put in there, you can do that. I think we'll go ahead and stop the recording now so that we can ask questions in a more comfortable way without being